Hey everyone! Today, we're talking about a topic that affects a lot of people, and that's anxiety. Anxiety can be debilitating and can impact all aspects of life, but did you know that the root cause of anxiety is often misdiagnosed or misunderstood? In this video, we'll dive into the real causes of anxiety, and how you can address them effectively. Everyone worries or feels nervous from time to time. Anxiety is a normal human reaction to stressful situations. But for people with anxiety disorders, those fears and worries aren't temporary. Their anxiety persists, and can even get worse over time. Anxiety disorders can severely impair a person's ability to function at work, school, and in social situations. Anxiety can also interfere with a person's relationships with family members and friends. Fortunately, though, there are effective treatments for anxiety. In some cases, medications have a role in treating anxiety disorders. Yet research shows behavioral treatment, alone or in combination with medication, is a highly effective treatment for most people with an anxiety disorder. What is anxiety? Anxiety is a normal human response to stress, but it can become a problem when it starts interfering with daily activities. Anxiety disorders are the most common mental health condition in the US, affecting around 40 million adults each year. Some common symptoms of anxiety include restlessness, irritability, excessive worry, and physical symptoms such as muscle tension and difficulty sleeping. Anxiety is a feeling of fear, dread, and uneasiness. It might cause you to sweat, feel restless and tense, and have a rapid heartbeat. It can be a normal reaction to stress. For example, you might feel anxious when faced with a difficult problem at work, before taking a test, or before making an important decision. It can help you to cope. The anxiety may give you a boost of energy or help you focus. But for people with anxiety disorders, the fear is not temporary and can be overwhelming. Commonly misunderstood causes of anxiety. Many people think that anxiety is caused by external factors such as work, relationships, or financial stress. While these things can certainly contribute to anxiety, they're often not the root cause. Another commonly misunderstood cause of anxiety is genetics. While there is a genetic component to anxiety, it's only a small piece of the puzzle. The real causes of anxiety. So what is the real cause of anxiety? To understand this, we need to look at the functioning of the brain. The root cause of anxiety is often imbalances in the brain's neural pathways. This can be due to imbalances in neurotransmitters, such as dopamine and serotonin, or due to overactivity in the amygdala, which is the part of the brain that processes fear. Another contributing factor is chronic stress. When we experience chronic stress, it can lead to changes in the brain structure and function, which can then contribute to anxiety. Additionally, past traumatic experiences can also lead to changes in the brain that can cause anxiety. Fixing the real causes of anxiety. So, now that we know the real causes of anxiety, how can we effectively address them? Here are some strategies that can help. 1. Mindfulness and meditation. Practicing mindfulness and meditation can help to balance the brain's neural pathways and reduce anxiety. 2. Exercise. Exercise has been shown to be an effective way to reduce anxiety, as it helps to balance neurotransmitters and reduces stress. 3. Therapy. Cognitive behavioral therapy, CBT, and exposure therapy are two effective forms of therapy that can help to address the root causes of anxiety. 4. Lifestyle changes. Making lifestyle changes, such as reducing caffeine and alcohol intake, can also help to reduce anxiety. 5. Medication. In some cases, medication may be necessary to address the root causes of anxiety. However, it's important to work with a healthcare professional to determine the best course of treatment. Understanding the connection between anxiety and physical health. Many people don't realize that anxiety and physical health are closely connected. Chronic stress, which is often a contributor to anxiety, can lead to physical symptoms such as headaches, muscle tension, and digestive issues. Additionally, anxiety can also exacerbate pre-existing health conditions, such as heart disease and autoimmune disorders. The importance of self-care for anxiety management. Self-care is an important part of managing anxiety, as it can help to reduce stress and promote overall well-being. Some self-care activities include regular exercise, a balanced diet, getting enough sleep, engaging in enjoyable hobbies and activities, spending time with friends and family, taking breaks and practicing relaxation techniques. The role of social support in anxiety management. Social support is also an important factor in managing anxiety. Having a strong support system can help you feel less isolated, reduce stress, and provide you with a safe space to discuss your feelings and experiences. Overcoming negative thoughts and worries. Negative thoughts and worries are common in people with anxiety, but it's important to remember that these thoughts are not always accurate or reflective of reality. One effective strategy for overcoming negative thoughts is to challenge them with evidence-based reasoning. You can also practice mindfulness and focus on the present moment, which can help to reduce worry and increase calmness. Staying positive and moving forward. It's important to remember that managing anxiety is a journey, and it may take time to see results. However, with perseverance, determination, and the right tools and resources, it's possible to overcome anxiety and live a fulfilling life. Stay positive and be kind to yourself, and remember to celebrate your progress along the way. Understanding the link between anxiety and substance abuse. It's not uncommon for people with anxiety to turn to drugs or alcohol as a form of self-medication. However, this can lead to a cycle of substance abuse and worsening anxiety. It's important to address both the anxiety and any substance abuse issues in order to achieve lasting recovery. Coping with anxiety triggers. Anxiety triggers are specific events, thoughts, or experiences that can trigger feelings of anxiety. By identifying your triggers and developing coping strategies, you can reduce your risk of experiencing anxiety in these situations. Exploring alternative therapies for anxiety. In addition to traditional therapy and medication, there are alternative therapies that can help with anxiety. These include yoga, acupuncture, massage therapy, and herbal remedies. It's important to discuss these options with a healthcare professional to determine if they're appropriate for your individual needs. The impact of technology and social media on anxiety. Technology and social media can have a significant impact on anxiety, as they can contribute to feelings of comparison, self-doubt, and constant stimulation. To reduce the impact of technology and social media on anxiety, it's important to limit exposure and engage in activities that promote calmness and relaxation. Seeking professional help for anxiety. If you're struggling with anxiety, it's important to reach out for help. A healthcare professional can help you identify the root causes of your anxiety and develop an effective treatment plan. There's no shame in seeking help, and it's a sign of strength to take the steps necessary to improve your mental health. The benefits of cognitive behavioral therapy for anxiety. Cognitive behavioral therapy, CBT, is a form of talk therapy that can be effective in treating anxiety. CBT focuses on identifying and changing negative thought patterns and behaviors, and can help you develop coping strategies for managing anxiety. CBT is widely researched and considered a gold standard treatment for anxiety. The importance of mindfulness for anxiety management. Mindfulness is a state of awareness that focuses on the present moment. Practicing mindfulness can help to reduce stress, increase calmness, and improve overall well-being. Mindfulness techniques include meditation, deep breathing, and yoga. The role of medication in anxiety treatment. Medication can be an effective part of anxiety treatment, but it's important to consider the potential side effects and long-term impact. Some common types of medication for anxiety include antidepressants, benzodiazepines, and beta blockers. It's important to discuss the benefits and risks of medication with a healthcare professional to determine if it's right for you. Combining therapy and medication for optimal anxiety. Some people, the most effective approach to treating anxiety may be a combination of therapy and medication. This can help address both the psychological and biological causes of anxiety, and provide you with a comprehensive treatment plan. Conclusion: anxiety can be a difficult and overwhelming experience, but understanding the real causes of anxiety is the first step to effectively addressing it. By following the strategies outlined in this video, you can start to reduce your anxiety and improve your quality of life. If you found this video useful, give it a thumbs up and share it with your friends, so we can keep making them. For more videos, subscribe this Mental Game channel and remember to click on the notification. Also be sure to check out our other videos as well. Thanks for watching.